Now, fair number of times, one is not operating only at one place. He goes hopping from one place to other place. That is the time when the problems arises. And that is the time we have to manage what is to be done. Now, how does one go about? Now, inventory management is not something which starts at the time of OT booking. When I am booking the theatre, say in a given hospital has a 5 operation theatres, we need to see that there are no overlapping bookings, there are no OT is fully furnished, fully available for all the facilities are available. Implants management, instruments and equipment managements, and personnel. Now, I will go one by one. Now, overlapping bookings are a worst thing and which has been seen quite often. If there are 5 OTs, if the IT fractures are going on in 2 OT, you may not get the available CM image intensifiers or available equipments in both the OTs. You may not get the SAW available in both the OTs. You may not get the, if the TKRs are going on, you may not get the SAW. If the drills may not be available at all the places. So how do you go about? The fracture table is not available. Then, so OT, while doing the booking of the OT, one needs to inquire about the availability of a CM, availability of the fracture table, the cauteries which is required for your requirement is available or not. Tourniquet, if you are doing in upper extremity or lower extremity where the tourniquet is required, extra drills and saws which are available or not. Now, what you need to go through all the structures is this, that extra lights which are available or not, the endoscopy equipment if you are doing a scopy, if the standby equipments are available or not. Now, if you drop the equipment, which is quite common, once in a while it does happen, so whether the flash autoclave is available or not. Now, another problem which we have faced when we are hopping from one place to another place is that the smaller nursing homes may not have a larger autoclave wherein they cannot sterilize the long guide wires, guide pins or the larger cutters or large reamers. That is what needs to be inquired beforehand and planned accordingly. Now, booking of the similar surgeries should be avoided. Fracture tables availability. I am just summarizing everything. While doing OT booking, one has to see to it that all these structures are available. Now, implants. When you are ordering the implant, the proper order of the implant should be done. Fair number of times it is done by a junior surgeon or an assistant. He forgets something and then you do not get. Formerly, when we were operating only in one nursing home, we used to have all the set of implants. Today, one is ordering from a company. Company may send something, he may send lesser implants. So one needs to see that. All those possibilities should be kept in mind. Like if I am doing a DHS or if I am doing a PFN, the bailout implants also should be available. The alternate additional fixation methods also should be kept in, it should be kept as a standby. And if some implants are dropped, the flash autoclave facility should be there. Now, what are the instruments or equipments you will keep as a bailout option? Now, the circulage wire is one thing which I feel has bailed out a lot of us, many of us on number of occasions. Now, and then cancellous screws, K-wires. In certain situations, the external fixator also works well. They also act as a bailout option. Now, another thing which you should keep in mind, friend in a neighborhood or a friend in operating in other OT or some equipment which are available in the nearby place where you can rely on, who can lend required support in terms of the implants, instruments, etc. Now, this is one simple case wherein it was looking so innocuous, shaft humerus, and when we opened up, we found that the fracture line was extending right to the neck. We had no other option, but whatever was available, we have used it up. Here also, while inserting the prosthesis, the neck cracked a bit. So, circulage wire helped us a lot. The drill bits of the different sizes and diameters as well as the different lengths should be kept in position. Now, this is very, very important when we are going to the different small hospitals. There was a time when we were operating in a small nursing homes, going from one place to other place. They did not have enough facilities. There were some gynec nursing homes, there were some surgical nursing homes, so which was not having. Today, of course, the scenario has changed in a larger institutes, but not in a smaller nursing home still. Now, the different screwdrivers also, like for example, formerly it used to be only a cross screwdriver. Now there are different screwdrivers are available. So we have to keep screwdrivers of a different size and different shapes for everything. These are the things which is very important when you are doing an implant removal. Not necessarily only while removal. When you are inserting the implants also, it is important. Screw removal instruments in the different sizes of the osteotomes also should be kept in a, it should be available so that you should not get stuck over there. Now, what are the equipments and instruments which you would like to keep in as a checklist? OT table, whether the particular OT table which you want, like if you want a fracture table, if you want a normal table, radiolucent table, then tourniquet, cautery, C-arm, extra saw, extra drills, drill bits of a different sizes, charged batteries for the cordless drill, proper sterilization equipment for the long guide pins and a large cutters, reamers, specific instruments for the specific surgeries, wire cutters. Wire cutters, you will not get it anywhere except orthopedic hospitals. So, like if you are operating in a, even if you are operating in a big corporate hospitals, this thing can arise. Because corporate hospital, if you are, somebody else is operating in other theater where the instruments are being used, so whether extra sets are there or not, one needs to cut out. Screw removal set and scopy lepro sets. Then personnel management is another thing which we have seen quite a problematic. The ward boys are not equipped, they are not trained well in terms of orthopedic surgeries. So proper trained ward boys, like many times I see a lot of arthroscopic surgeons, they carry their own ward boys. They have trained them for a particular type of surgery. So it becomes easier for them. Then OT staff, nurses, other support staff, and all should be well trained. That is what I feel it should have. This was mainly applicable when the culture of a small nursing home was there. Today, the things have changed drastically. There are lots of people are operating only in a corporate hospital where the facilities are there. But there also, if you have 6 OTs and the 2 OTs or 3 OTs are running the similar type of surgeries, then adequate equipmentation is there or not. That is extremely important. So, in a bailout options, one has to keep the cerclage wires, instruments, implants. One has to definitely take care of that. I thank you for the patient hearing.